Welcome to Arazy Group's regulatory update. In today's update, we're going to give you a regulatory wrap-up in UK that will include information related to recognition of CE-marked MD. On the 16th of February 2026, the Medicines and Healthcare Products Regulatory Agency, MHRA, in the United Kingdom, issued a targeted consultation on the future regulatory approach for CE-marked medical devices in Great Britain. This document is a public consultation rather than a final regulation, inviting stakeholders to provide feedback before any changes are implemented, and it applies exclusively to Great Britain, England, Scotland, and Wales, excluding Northern Ireland. Following Brexit, the United Kingdom introduced the UKCA marking as its own conformity assessment system in 2021, while continuing to accept CE marking on a temporary basis to avoid disruption in the supply of medical devices. The transitional period currently extends until 2028 or 2030 depending on the device type, and approximately 90% of devices in Great Britain remain CE marked, reflecting a continued strong reliance on EU approvals. The main regulatory challenge addressed is ensuring continuous access to medical devices in Great Britain, as many manufacturers have delayed transitioning to the UKCA system due to its complexity and associated costs. This has created a continued dependence on EU approvals, and if recognition of CE marking were to cease, it could lead to potential device shortages. As a result, there is a clear need for a long-term regulatory solution to maintain supply stability and market access.
If you want to manage your product registration, consider Regislate, our global registration management software for fast and effective market access processes.
The first proposal focuses on extending the acceptance of medical devices approved under the former EU Medical Device Directive, MDD, aligning Great Britain's timelines with those of the European Union until December 2028. This measure is intended as a short-term continuity solution to avoid supply gaps during the transition to the EU Medical Device Regulation, MDR, ensuring continued availability of devices while supporting a smoother regulatory transition. The main proposal of the consultation is to allow indefinite recognition of CE-marked medical devices that comply with the EU Medical Device Regulation, MDR, or In Vitro Diagnostic Regulation, IVDR, eliminating the need for additional UK pre-market review. This approach aims to enable faster market access and reduce regulatory burden, with two potential options under consideration: recognizing all eligible devices or limiting recognition to those with equal or lower risk classification in Great Britain. The third proposal introduces an international reliance route for devices that are classified at a higher risk in Great Britain than in the European Union. Under this approach, such devices would undergo a limited additional review by a UK-approved body, providing a streamlined alternative to the full UKCA process, while maintaining appropriate safety oversight.
Thank you for following our regulatory updates. If you have any questions, need more information, or would like to book a demo of our software, please email us at info@arazygroup.com, or simply head to our website and head to the Contact Us page.